Make sure to check these 7 benchmarks as you go to complete this skill. A step that is highlighted in red and bold type is called a critical element step. Critical element steps are important steps that must be performed correctly in order for you to pass the skill. If you leave out a critical element step or do not perform it correctly, you will not pass the skill. Good luck!
In this video, we're going to be looking at skill 15, performs range of motion on one knee and ankle. It doesn't matter which leg you choose to do your skill on, just use your space to your best advantage. The important points to remember about range of motion of the knee and ankle, it's extremely important your patient is supine or flat on their back when you do this skill. And also we need to address pain with our patient right at the beginning. Coming in, I want to reassure my patient that I will stop if they're experiencing any pain or discomfort. As CNAs, it's never our job to push people past the point of pain. So it's really important that you have that sorted at the beginning so your patient knows to speak up if they're feeling painful at all. Knocking. Good morning, Miss Megan. My name is Teddy. I'm your student nurse aide, and I am here to do some exercises on your left knee and ankle. Is that okay? Perfect. So I'm going to make sure that you're private. I'm going to make sure your bed is locked and in the lowest position. It's really important we have you flat on your back for this, and you have your call bell in your hand. I'm going to wash my hands, and I'm going to come and uncover my patient from her ankle, from her foot to her knee. It's not necessary to completely uncover her for this. It's overexposure, and again, we're talking about cold stress. All right, Miss Megan, I'm going to be doing some exercises where I'm going to bend your knee 3 times, and then I'm going to flex your ankle 3 times. If at any time you experience any pain at all, I'm happy to stop. So just speak up and let me know, okay? Now, for this skill, you don't have to wear gloves. In the real world, we would likely be wearing gloves if we're touching feet, but at the state, it's not necessary. I have washed my hands. I have very carefully explained what I'm going to do. It does not satisfy the requirement to explain to your patient to just call this a range of motion. They may not know that medical terminology, so we want to make sure that we've gotten express consent from them before we start any skill. All right, so I'm going to just uncover this left leg up to the knee, and you're going to feel me touching you on the bottom of your heel and then behind your knee. Now, it's very important for your range of motions that your hands always be underneath the joint when you are doing these exercises. What that means is that my palm is squarely underneath the joint. Fingers does not satisfy as underneath. So when I am coming for this skill, I'm going to scoop underneath my patient's knee so that I give her better support. I want her heel firmly in my palm with my thumb wrapped around the bottom of her heel. Make sure that you have her by the heel and not by the ankle. We always want to support the joints. So in order to keep from making that mistake at this state, you want to keep your hand flat on the bed when you are bending her knee. Do not lift her foot up off the bed. The minute you lift her foot off the bed an inch or 2, now you're involving the hip joint, and they'll get you for that. So I want to scoop underneath the knee. Again, Miss Megan, let me know if anything hurts. And I'm scooping at her heel, wrapping my thumb behind her heel. We're going to do each exercise slowly and methodically for 3 times. If I am rushing through the exercise, it will not give your patient a therapeutic effect. They will fail you for that at state. So the best way to make sure that you're moving slowly and methodically is to do a 1/1000 count when you're bending the knee. And what I mean by that is 1/1000, 2/1000, 3/1000. 1/1000, 2/1000, 3/1000. I'm not lifting my hand off the bed, and I'm fully flexing and extending her knee. We're going to do each one for 3 times. 1/1000, 2/1000, 3. 1/1000, 2/1000, 3. Last one on your knee. You doing okay? Perfect. 1/1000, 2/1000, 3. 1/1000, 2/1000, 3. Okay, Miss Megan, now I'm going to flex your ankle back and forth. Bring her blanket down to cover her knee. All we're working on now is just the ankle, so we don't need that leg entirely exposed. I'm going to leave my hand firmly cupped underneath her heel. And as I'm pulling, dorsiflexing her ankle towards her head, my palm is in the middle of her foot at the ball. Stay away from toes. Toes aren't stable. That will get you in trouble. So I'm grabbing right at the middle of her foot, and I'm going to flex towards her head. 1, 1,000, 2, 1,003. I'm then going to rotate my hand to the top of her foot to push back towards the bed. 1, 1,000, 2, 1,003. Rotate, pull. 1, 1,000, 2, 1,003. Rotate, push. 1, 1,000, 2, 1,003. Last time. 1, 1,000, 2, 1,003. 1, 1,000, 2, 1,003. Did that feel okay? Perfect. Now, if you do switch your hands for this, that's okay. We're still just going to go back and forth around the patient's foot. Doesn't matter which hand you use for that, just as long as you're always underneath the joint. So I've completed both exercises. I'm going to cover her back up and then do our closing up steps as always. So the bed is locked. You're in the lowest position, flat if you wish. You have your call bell within reach. Miss Megan, would you like for me to reopen your privacy for you? Perfect. I'm going to stop and make sure, double check yourself at the end of this. Please take the pause and make sure that you addressed pain. Remember, if you forget a step, you can easily correct that before you say skill complete. So let's imagine in the beginning that I hadn't closed her privacy curtain. At the end, if I'm looking around and checking back on what I've already done, I would catch that mistake. And how I would fix that is to say, Miss Megan, I should have made you private before we started. I'm going to go ahead and take care of that now. And then I would come over and close her privacy curtain to make sure I had hit all of my steps. In order to correct a mistake, you have to say what you would have done, when you would have done it, and take the action. So it's not enough just to say, I would have closed the privacy curtain. I actually have to take that action. If I had made that mistake, I've corrected it now. I've been given credit for it, so I can say, wash my hands and skill complete. Please remember that everything can be corrected except for a safety stop. So if you feel like you didn't do a step, even if you did do it, it won't hurt to do it again. So skill complete.